slightly more difficult. In terms of the role of the ESA, well, at the bottom, it's what we're aiming to do, is produce for our patients evidence-based, high-quality patient care. And the ESA is trying to contribute to this process in two ways. Firstly, by producing the guidelines, but also further upstream, if you like, in producing high-quality research evidence, which will ultimately influence clinical practice. And there is now a clinical trials network within Europe and sponsorship of high-quality studies, which in the end, I hope, will improve further the research evidence for perioperative care. Because as you know, although there is plenty of evidence around for anaesthesia and critical care, there isn't always enough, there isn't always evidence in the aspects of practice that we really need guidance on. So the European Society of Anaesthesiology is very committed to improving this process at two levels and harnessing the skills and enthusiasm of its members. Our vision, set out by myself and our president in an editorial in the European Journal a few months ago, is summed up in the acronym COSITRA: collaboration, simplicity, and transparency. I'm just going to explain a little bit what I mean by that. In terms of collaboration, that works on different levels. That's between the different scientific subcommittees of the Scientific Committee of the ESA. It's collaboration with other anaesthetic societies, with the national societies, and specialist anaesthesia societies in Europe as appropriate. It also is another focus for collaboration between the ESA and the European Board, and with other European medical organisations. For instance, we were closely involved with the guidelines for management of the non-cardiac surgical patient, which the European Society of Cardiology produced, which were published last year. In terms of simplicity, the actual practical guidelines, the summary, should be as short and useful as possible. We aim to make guidelines widely and easily available, so as well as the European Journal, they'll be on the ESA website, and there should be short versions which you can download and put on your phone and such like to use in practice. And these are the short summaries that we're planning to produce, as well as having a longer document which allows anyone who's interested to go back and see the evidence that underlies the recommendations that have been made. In terms of transparency, clearly there's not always a perfectly right answer on which all the experts can agree. So what I'm quite happy to see, in fact which I would encourage in the guidelines, is something that says where experts disagree, it's quite acceptable to make this clear and actually say, in this situation, there is a lack of evidence and there's a lack of guidance to say exactly what you should do, but the following courses of action are both acceptable. And I think that's okay. I think it's a mistake to pretend that everything is clear and unequivocal when actually there's still some ambivalence around. The second aspect of transparency is that declarations of interest or statements of interest should always be made by the members of the task force, by people who are reviewing the documents, and so on. It's rare, I think, for anyone who's become more senior in the anaesthesiology world not to have had some connections with industry, for instance. The question then is it relevant to the guideline that's being produced, and does it affect their judgment? Well, of course, usually not, but I think it's right that we should all state where our interests lie, so that things are very clear and open. The final aspect of transparency is in red, because I think it's the most important. We need research evidence, but as I said, sometimes the evidence is lacking. And in that case, we need expert opinion. We need them both. The problem comes when opinion is presented as evidence, because it's not. So although we need them both, I think it should be very clear, both in the guidelines and in practice more generally, which is evidence and which is opinion. Our principles are very simple. We start with existing guidelines and appraise them. We update the searches from the last high-quality guideline we can find and summarise the evidence. And then we produce the guideline, making very explicit the level of evidence behind it, just like I showed you in the table before, and the strength of recommendation that the expert group feels they can make on the basis of that evidence. We've been using the SIGN system produced by the Scottish Intercollegiate Guidelines Network, and as you can see, it roughly mirrors the hierarchy of evidence I showed you earlier in the talk. For each guideline, once we've chosen the topic, we set out the scope and we work with the chair of the task force to decide that. We've been lucky to have the services of the Cochrane Anaesthesia Review Group based in Copenhagen for their searching and appraisal skills, working on two of the three guidelines we've set up so far. As I said, we formed the task force whose job it is then to translate the evidence into a guideline and to write the draft. The draft is then circulated, we get feedback, we try it out in practice, and then produce a final version for dissemination and implementation. Now, the review process is really important. And once the draft is produced, it goes to members of the relevant scientific subcommittees for scientific review. It also goes onto the ESA website. And I hope that when the two guidelines that are approaching the end of their process were posted on the website and you saw them and had the opportunity to respond, members should have had an email to invite them to do so, and I'd like to thank everyone who did. That was very useful. But I think this is quite unusual. I think it's quite innovative to give every member of the society a chance to see and comment on the guidelines that we're producing before they're actually finalised and produced. And I'd encourage you to make use of that opportunity in the future as well, because all the feedback is tremendously valuable. It's also sent to a various number of external organisations and societies who we think may be interested in seeing what we're doing or may be able to offer us further advice or possible endorsement, in fact. So far, the ESA has worked on these topics, on perioperative fasting, which we're going to hear about this morning, preoperative evaluation for adults. A third task force is now a year into its work, producing advice on the management of severe bleeding. And the fourth topic has already been published towards the end of last year, recommendations on the management of regional anaesthesia in the presence of anticoagulation or antiplatelet agents was produced. And actually that comes from a working party which was set up even before the Guidelines Committee was established. So I'd encourage you to look at that. It was published in the European Journal towards the end of last year. There we are, that's it. Gogarten and colleagues. So, the timelines for these. The fasting one will be in the European Journal in the next couple of months. The preoperative evaluation one will be launched in a similar session to this at the autumn meeting in Krakow in November, and will probably appear in the journal just before that. And we're hoping that the management of severe bleeding will be ready to be presented at the autumn meeting next year in 2012. In the future, well, the ESA Clinical Trials Network will continue to help to generate research evidence to shape future guidelines. The ESA is committed to continuing to produce high-quality guidelines. They're freely available for everyone, and you're invited to use them. And you're also invited to comment on them and tell us what you think, because they will be updated and revised. And also, we want to produce something that's as useful as possible to our members. And if we hear from you, we can try and do that to the best of our ability. Thank you very much.